Hi, welcome back to my channel. I'm Dr. Shilpa, laparoscopic surgeon and fertility expert from Bangalore. So today we have one of the most important videos about IUI, that is the success rate of IUI in India. IUI, as we all know, is Intra Uterine Insemination, which is a very simple, affordable and a straightforward procedure done in the outpatient department. So here IUI in factors like mild endometriosis, unexplained infertility and mild male factor, that is mild motility, morphology and count issues in the semen, has given good results. So we are here trying to brainstorm and find out what works and what doesn't work in cases where IUI can be helpful and where IUI can't be helpful, and what determines the success rate of IUI. So we'll go step by step. The first factor is the factor of the cause, that is what is causing the fertility issues. So as I have told you again and again, the male factor issues like the motility, count and the morphology of the semen parameters, if they are mildly abnormal, then the success rate is good. If it is mild endometriosis, then also the success rate is good. If it is the case of unexplained infertility, then the success is reasonably good with IUI. So in all these three cases, usually the success happens between 3 to 4 cycles and the success rate is about 12 to 15% per cycle. The second factor is the ovulation induction protocol or regime that is used. So in most of the cases of IUI, we use medications for the woman to ovulate, and the type of medications used, whether it is tablets, whether it is injections, whether the woman has got one follicle, one oocyte, or there are multiple follicles, and how is the endometrium when the stimulation is happening, all this determines the success of IUI. Also, the technique of semen preparation and the semen parameters. So the semen parameters, as I have told, if it is mildly abnormal, then IUI is the treatment of choice, and the center where it is processed, whether the center has expertise in processing the IUI sample, is again adding on to the success rate. So the last factor is whether post medications for the post IUI, whether the woman takes it regularly and whether it is rightly given. So all these factors add up to the success rate of the IUI. And roughly in India per cycle, again I tell you that the success rate is about 12 to 15% only. So combined 3 cycles to 4 cycles, the success rate will be about 40% if it is done correctly by an expert in the expert lab, using the right medications for ovulation induction and choosing the right couples who are eligible to undergo the IUI. So if there is a tubal block, then IUI definitely will not work. If there is a factor where the semen count or the sperm count is less than 1 million or less than even 5 million, then the IUI is not the choice of treatment. So when we choose the treatment of IUI, we have to judicially choose it, and also we have to be realistic about the success rate which it offers. So if you have any doubts regarding any of these factors, you can put your comments in the comment box. We'll be willing to answer it for you. And if at all, if there is anything that you need to discuss it with us, you can call us on this number which is given below. I will come back with better and more informative videos in the future. Thank you very much.